Acute coronary syndrome (ACS) describes a range of conditions associated with sudden reduced blood flow to the heart. The blockage can be sudden and occur in one instant. The condition occurs due to the buildup of fatty deposits in and on the walls of the coronary arteries. Symptoms can be chest pain or discomfort, shortness of breath, feeling dizzy, or lightheaded. The condition is caused by unhealthy habits such as smoking, high blood pressure, or cholesterol, physical inactivity. To prevent it, we must maintain a healthy lifestyle and diet, drink plenty of water, and exercise. We will discuss what ACS is and what it does, along with how to detect it in this DPEF video. Hello everyone, welcome to Denmark-Pakistan IT Entrepreneur Forum's Health Talk, a much anticipated health talk I must add. We are here today and hosted by two Denmark-based doctors who are born in Denmark, but they have origin in Pakistan, from Pakistan, and they'll be here to inspire about health talk solutions. The purpose today with this talk is to inspire new startup companies and new companies who would like to make solutions within health talk. So I'd like to welcome Mona Firdous Akram and Sanam Nusrat Tahir, who will come here and talk about health.
Hello.
Hello, welcome.
Thank you.
Thank you.
Great. So I understand that you'll be talking about blood clots and inspiring about what blood clots are, what's going to happen when you're hit by a blood clot, and the whole process around that.
That's right. We have had the honor to be talking about acute coronary syndrome today, ACS.
That's fantastic. Well, the stage is all yours.
Thank you, DPEF, for inviting us and for the fine introduction. My name is Sanam Nusrat, and I'm currently working at Roskilde Hospital Cardiology Department.
And my name is Munazza Firdous Akram, and I'm also a doctor from Denmark, and I do have experience from Cardiology Department, Gentofte Hospital.
And today we have the honor to talk about acute coronary syndrome, ACS. So what are we going to talk about today? Shortly about the definition, some of the causes, heart anatomy, and the division. It's divided into unstable angina, non-STEMI, and STEMI. Some of the symptoms, how it works in Denmark, and shortly about the treatment as well.
So ACS is a group of conditions that occurs when blood supply to an area of the heart muscle is suddenly reduced or blocked. A reduced blood supply is also termed ischemia. Prolonged ischemia can lead to death of the heart tissues. A common cause of ACS is formation of a blood clot in an artery, which is already narrowed by these atherosclerotic plaque. We are talking about the coronary arteries. These arteries are located in the heart. A plaque is a deposit of lipids, fiber tissue, and calcium. It is slowly formed in an artery, and it gets inflamed. Later on, it can lead to exposing of those substances and promotion of coagulation, which lead to these blood clot formations. So the end result is a blockage and reduced blood supply to an area of the heart muscle. So the causes. The most common cause is atherosclerosis, and some of the risk factors are smoking, diabetes, hypertension, high age, male gender, high cholesterol level in the blood and inactivity.
The heart anatomy. Our heart have a left side and a right side. And as you can see, these are defined as the pulmonary arteries, which are the arteries going to the lungs. They get the oxygenated blood from our lungs, and then they come back through our body, where the blood and the oxygen is delivered to our organs, our muscles and tissue. And then it comes back from the left side of our heart, which is through this aorta, a big vessel, and back to our heart again. And that's the cycle that keeps on going. We also have a cycle with the blood supply to our heart through these vessels. These are the coronary arteries. And as you can see, and because of all of the causes that Munazza also mentioned, over time and age, we develop these plaques around our vessels. And in this picture, you can see that the vessel are sort of being built in the innermost layer of our vessel and constricting the blood supply and oxygen level to our heart. This is a normal blood vessel, and we have got the inner corner here, or inner layer here, and then the middle layer and the outer layer. And over time, a plaque is formed in the most inner layer of the vessel, and it consists of cholesterol, calcium, and other proteins. And in this picture, it's still not a constriction yet.
So these are those conditions, and it depends on the location and the extent of obstruction, which can lead to one of these conditions. You can differentiate between these three by the ECG findings and cardiac marker levels. If we take unstable angina first, the cardiac marker levels are usually normal, but can be slightly elevated, where non-STEMI and STEMI, you will see elevated cardiac markers. In unstable angina, you will have an incomplete obstruction, but no infection. Where in non-STEMI and STEMI, there will be a complete obstruction, and the infection will be in the inner layer in non-STEMI, where in STEMI it will extend to other layers of the heart muscle or heart wall. And the ECG findings are different in non-STEMI and STEMI. In STEMI, the ST segment is elevated, where in non-STEMI you can find different kind of ECG findings like ST segment depression or T inversion. So unstable angina. What you can see on this picture is a vessel, and this vessel is, you can see that there is a formation of a plaque, and this plaque, it can reduce the lumen, but this condition is stable. It can get unstable, where you will have a blockage of the pathway. Thereby, you have to treat it with, for example, medication, or a balloon dilation, PCI, or bypass or stent.
A non-STEMI is defined as non-ST segment elevation myocardial infarction. And it's the same vessel, and as you can see on the picture, we have got this plaque formation, but in this picture and in this condition, we have a sudden rupture of this plaque. And this is now considered as being a damage in our body. And our body works in a way where it sort of tends to send a lot of blood plates and solidification proteins to the area that has been damaged. And this will over time lead to this, which is a small blood clot defined as a non-STEMI. As you can see, it is partially blocking the pathway for the blood supply to our heart, and it is treated with balloon dilation and stent within 48 hours here in Denmark.
So, a STEMI, also known as ST segment elevation myocardial infarction. And I do have a picture again here with a vessel. It is filled with blood plates and solidification proteins, which lead to this blockage, and there is a full blockage. That's why it's called a big blood clot. It should be treated as soon as possible, either with balloon dilation, stent, or bypass, and also medication. So how do you experience it? You can either get some chest pain, which can go to your hand or arm, or go to your back. You can also get some general discomfort or anxiety, and some shortness of breath.
How it works in Denmark. Normally, when a person or a patient gets this chest pain, we tend to call 911, and in Denmark it's called 112. The ambulance will arrive within short time, minutes, and so on, and they have the capability of taking some vital parameters, such as blood pressure. They can take the pulse, the respiration rate, and the saturation. They can also take an ECG and a cardiac biomarker called TNT or TNI, which is very specific for whether it's a blood clot or not, all depending on the level of the rise in TNT and TNI. They also can consult with a cardiologist at a hospital and thereby go to where the treatment is best for the patient, whether it's a STEMI, an unSTEMI, or an unstable angina, or something else. Shortly about the treatment, we have got the balloon dilation PCI as an opportunity where we put stent in, bypass operation, CABG, and then the medical treatment as well.
So what is a balloon dilation? It is where we insert a catheter in an artery, either in your leg or in your arm. And this catheter is located, we do insert it as where we locate the vessel with the plaque, usually in those coronary arteries. And when we are there, this picture shows a really good step-by-step method how we do it. You have the catheter with the balloon, it's uninflated, and later on we do inflate the balloon, and we can do it more than one time, and then in the end we take the balloon and catheter out, and we will have a dilated or widened vessel. It's the same way with the stent. You have this catheter with the stent, and when you are to the vessel with the plaque, you inflate the balloon, and later on you take the catheter and balloon out, and what remains is the stent and an open artery.
Then we have got the bypass operation, which is a more risky and a bigger operation, usually done when it's not possible to do the stent, or if there is a blood clot in more than one artery. As you can see in this picture, we have got the coronary arteries, and here we have got some blood clots. Through the bypass operation, we have the opportunity to take some veins from either your leg or from a area, and then make a pathway around where the blood clot is, just so that we have got the necessary blood supply to the heart. Yeah. And then we have got the medication we can give. We have got blood thinning medication. We have got beta blockers, some cholesterol reducing medicine, and then nitroglycerin.
So the blood thinning medicine is used to prevent new blood clots, and there are different kinds of blood thinners. Yeah, the beta blocker is used to prevent this angina pectoris, where you can get those heart cramps, and it is by reducing the heart rate, so you reduce the heart's need for oxygen. It will also reduce the blood pressure and prevent new blood clot to form.
And then we have got some cholesterol lowering medication. We have got some bad cholesterol and some good cholesterol, and the bad cholesterol cholesterol is called LDL cholesterol, and after you have had a blood clot here in Denmark, we set the goal to be under 1.4. So, and that's why we give some cholesterol lowering medication, which is a drug that inhibits the liver's forming of cholesterol and thereby reducing the LDL as well. Then we have some nitroglycerin, which is a medication that can be given as a spray or as tablets. And they work by dilating the vessels so that you can have a lot of blood and blood supplyment and oxygen to the heart, and thereby also preventing the heart cramps that you can get when you have blood clot. And it's not really working here.
That was the end. If you do have any questions, you can comment down below.
Thank you so much.
That's fantastic. We just had a really enlightening session in Denmark-Pakistan IT Entrepreneur Forum about blood clots from these two doctors that we have with us here today. Munazza, I would like to ask you, you said that Denmark is really good in handling blood clots. So what is it that makes Denmark so good in handling blood clots?
I would say that's the fast reaction and the fast treatment. We do already start the treatment in the ambulance, and so the time is really crucial.
Mm-hmm. I would agree. I think the time is very crucial, but I also think that here in Denmark we have got some specific guidelines, which I don't think they have in other countries. So they are also very important for the right treatment in the right time, or at the right time, sorry. Mm-hmm.
So we do also have heart starters in Denmark, right? So that's also impacting on the time when you suffer from a stroke. So you have people who can actually come and help you. So that's also putting down the time.
Yeah, for example, a blood clot can lead to cardiac arrest, and thereby it's really, again, crucial with the time. We do have those heart starters around different places in Denmark. And we do have some heart runners, which we do call them. And when there is, for example, a cardiac arrest, then those people will be called. And for example, within 5 minutes, the ambulance or the heart runner will be in that place with these heart starters. And that will lead to a fast reaction and fast treatment.
Mm-hmm. That's right.
So it means that if there are some startup companies out there who would like to enter this field and would like to record some of these markers, the health key markers that there are, then, there is a possibility that they can track some health monitor some health markers that can determine whether a person is, likable to have been suffering by a stroke or not, or going in that direction. Mm-hmm. So there can be some big data there that can be collected by companies and that can help a patient or maybe the healthcare system to even improve the treatment of blood clots.
That's right. But I think that would be not within or through the heart starters, but maybe through the vital parameters that the people in the ambulance can take. For instance, some of the blood pressure, and there's a respiration rate, there's a pulse, there's an ECG, and so on. And that's some of the findings that they should use. For instance, we have got some of the Apple Watches already today, which can measure or take an ECG, or they can take your blood pressure, they can monitor your pulse, and all of them are some parameters that can detect and lead to whether your condition is stable or if it's not stable, and that also gives you the possibility as a normal person to react.
Okay, so that's fantastic. So it means that collecting data as quick as possible, as early as possible, can save lives.
Yes.
And you can actually combine data with different data sets to figure out life quality and the way person is living his or her life, and whether he has in a risk factor to get into blood clots or stroke.
Yeah.
That's fantastic. Well, I will thank you very much to be here and to enlighten us about blood clots. So that's fantastic. And the Denmark-Pakistan IT Entrepreneur Forum would like to thank you a lot for being here. Thanks a lot.
Thank you
for
so much.
inviting
And
us.
thank you, DPEF, for inviting us.
Thank you.